My name is Gail Roboz. I'm a professor of medicine and director of the Leukemia program at Weill Cornell Medicine and the New York Presbyterian Hospital in New York City. It's always so hard to have a concept of the one big question, but I think for me it's going to be the high sensitivity MRD assays for NPM1 and actually initially for FLT3. Because I think the concept, we've done this in other diseases. We've had molecularly defined subgroups of leukemias that went from the worst to the best. So that happened in APL. It happened in, for example, Philadelphia chromosome positive ALL, where a combination of MRD measurement and novel therapy transformed worst to best. And maybe that's happening in FLT3. So FLT3 ITD, awful news, proliferative disease, bad outcomes. And now we actually see it moving toward the more favorable categories. And one of the things that your audience who might be watching this meeting will hear over and over again is the question of, are we ready to not transplant some of those patients? And you'll hear a bit of back and forth in the audience about whether or not transplanting FLT3 patients is a good thing or not. But I think that the selection of a high sensitivity molecular assay, and the front runner is FLT3, next runner in line is NPM1, and I would say third is KMT2 rearrangements, for high sensitivity, reliable MRD monitoring that will spare some patients transplants, will allow some patients to have rising disease levels eradicated with well-tolerated therapies. I think we're going to see those changes actually inside of the next couple of years.